So hi, everyone. If you don't know me, my name's Becky Vine. I'm the Programme Manager for the Midlands Finance Academy. So you may be aware, but you may not, that Jill Kilbury, who had been the lead for the Midlands Value Maker Network, has recently retired. So obviously you're used to seeing Jill at these meetings and running these meetings. So we do have a new chair or lead for this group, which is Zach Hussain, who is the Associate Director of Finance at UHB. He is running a bit late this morning, so I think he said he should be with us about 1:15. But you'll see from the agenda that Aoife shared that sort of first up was going to be Zach and myself, just talking to you a bit about this group and the fact that we are bringing in one of the Academy's work streams sort of into this group and what we are envisaging that looking like. So I think what I'll do is have a presentation to run through. So I'll get started on that, and then Zach can bring his thoughts in sort of when he joins us. So let me just share my screen. Okay, hopefully that's working. So just starting off with a bit of a reminder of the structure for anyone who has been less involved with this sort of regional academy and how that all works. So at the top there, you've got 1HS Finance and their 3 national programmes: Future Focus Finance, the National Finance Academy and the Finance Innovation Forum. The Value Maker Network sits over in the Future Focus Finance programme. And then underneath that, as part of the National Finance Academy, when this was started in around 2022 to 2023, they asked all of the regions in England to set up a regional finance academy that would sit under the National Academy and kind of feed up into their work. So the Midlands did that in sort of 22-23. We started a regional finance academy, and we have a board with representation from all of the 11 systems across the Midlands, as well as kind of a few key stakeholders that comes together every other month and sort of governs the Academy's work and feeds up into the National Finance Academy. But we also feed up into all 3 of those programmes sort of equally. We take the national priorities from 1HS Finance and what they're kind of looking for the regional academies to do, and then we also take input from the region directly, from finance staff on the ground, on what they want the regional academy to be doing and supporting them with. And then we put together a sort of programme of work which falls into 4 categories. So we've got 4 work streams that we run, which is professional development, EDI, NHS the Future, and networking, collaboration, innovation. A bit of detail there on the sort of current opportunities that we have live under all 4 of those work streams. So this is sort of work that we've been building on since the Academy launched in 2023. And right now, I'm not planning on sort of going into detail on what all of these are, because I wanted to talk specifically about one of the work streams today and how we bring that into the Value Maker Network. But if we have time, Aoife, at some other point in the meeting, then I'm very happy to kind of go back to this slide and just share some more information about a few of these opportunities if people are unaware of them, and particularly things that we sort of got coming up or going on at the moment. But what I did want to focus on for this meeting was our networking, collaboration and innovation work stream. So this is the original aim and sort of action plan that was set out for this work stream when the Academy launched and wrote its sort of first regional strategy. So we launched with a strategy which was a 2-year strategy from 2023 to 2025. So we are due to be kind of looking at the strategy at some point this year. And for this particular work stream, it was about providing opportunities for staff to network and share good practice, learning and innovation across organisations in the region. So you see there we had sort of a few actions to focus on and suggestions for how we could sort of measure the success of those. Over the course of sort of starting with this work stream, and we put together a working group to help. So this was NHS finance staff volunteering to be in the working group for this area, meet every other month and sort of help the academy with this action plan and kind of progressing it and turning it into opportunities for finance staff. So since we started working on that with the group, we have updated the action plan. So it now looks like this. So I will pop back to this in a minute and talk about it in more detail. But just to give you a bit of context of why I'm talking specifically about this work stream, we did an exercise recently where we reviewed the 4 areas and what we're kind of doing. The focus of doing this review was trying to understand if there was places that we could do a bit of streamlining. So particularly in terms of the ask of NHS finance volunteers who contribute to the Academy's programme, to see if we could, use that resource a bit more effectively, so we're not asking too much of your time and your resources. So the main sort of thing that came out of that review was that the networking, collaboration, innovation work stream, though we wanted the action plan and the work that we were doing in the area to remain, we thought we could take it forward in a more efficient way. So we took this to the board, and the suggestion was to take a similar approach that we do in the EDI work stream that we run. So what we do in that one is we use the existing Midlands Inclusion and Diversity Ambassadors as a group to help us take that area forward. So it was agreed that for the NCI work stream that we wanted to move it into the value makers. So it would be the Regional Value Maker Leads Forum who would become the kind of governing body for this work stream, and then yourselves as the wider Value Maker network to contribute to the work stream's progress. So the working group, the separate working group that we had has been closed down now, but all of the people who are part of that either are already value makers or have been encouraged to join the Value Maker network and come to these meetings and continue to help us shape the work stream and contribute in that way. So quickly in terms of the governance of how it works, so the action plan for the NCI work stream is going to be brought to these meetings, the quarterly regional value maker meetings, for people who come along to provide their guidance and feedback to the academy. Any kind of decisions for this area, particularly in terms of new projects and use of budget. So we do have some budget from the Midlands Finance Academy, which we put aside for this work stream. So the value makers can help us kind of decide how to use that. If we're making decisions on that, it will need to go up to the Midlands Value Maker Leads Forum as a group. And we can also put it up again to the Midlands Academy Board if needed. The Regional Value Maker Lead, which is now Zach, who's taken over from Jill, already sits on the Midlands Academy Board. So he'll be providing the board with kind of updates as part of their meetings and will be responsible for that reporting line into the board for this work stream and also for the Value Maker Network. Just a note on the Value Maker Leads Forum. So if you're not aware, obviously, you are a value maker and you can come to these quarterly meetings, but you can also volunteer to be part of the sort of leads group. So this is something that Aoife has been running for a long time. The leads tend to meet quarterly just before the wider quarterly meetings. A lot of what they have been doing has been around helping shape the agendas for sessions like this, what they want to see on there, what might be helpful, but also a bit of discussion about, the network in a wider sense and what it can be doing. So what I've been doing recently is working with Aoife to try and expand that Leads Forum group a bit. So we're aiming to have at least one representative from each of the 11 systems in the Midlands, so that we've got every system sort of on the Leads Forum. So you can see the ones where we've got gaps. So do let us know if you work in Coventry, Warwickshire, or Northamptonshire, or Nottinghamshire, and you're interested in joining this group, or have any colleagues who might be. And we're going to be, working with this group to really try and sort of strengthen it and their purpose and what they're doing with both the Value Maker Network are now kind of helping us with the NCI work stream. So this is just so kind of so you know who's on it, and yeah, so you can see where the gaps are if you work in those systems, you might be interested in joining. So what we're planning on doing as kind of next steps is to continue updates, sort of broader updates on the regional academy opportunities at Value Maker meetings. So that's what I've been tending to do at these meetings. Is I usually come along and give just a general what's going on in the academy, you know, across all 4 of our work streams, which I do want to make sure I continue doing, so that as value makers you're kind of aware of what the academy's got on. But obviously now more specifically we want to be talking about the NCI work stream with you. Also continuing to work with Aoife and the national team to try and help bring sort of relevant and interesting case studies to these meetings. So I think we had George Eliot Hospitals came along to the last one, correct me if I'm wrong, Aoife, and kind of talked about the work they've been doing to outreach to schools and colleges to promote NHS finance careers. So they shared that, and then it looks hopeful that we've got the July meeting someone from Arden and Gem CSU who worked on a EDI system-wide strategy in the Black Country, coming to talk about the work they did as part of that. So very much the Academy is working with ONF to try and bring some real value to these meetings and some presentations that all of you would find helpful. So sort of a new purpose is going to be very much highlighting specifically the NCI workstream content that value makers might be interested in engaging with, and bringing areas that are sort of under development for that workstream to these meetings, and getting your feedback and advice, and then also taking things to the Leeds Forum for sort of further approval. And I feel like I, you know, kind of going forward, very much want the Academy to be doing 2 main things. One is supporting you as individuals, because you've chosen to join the Value Maker Network, and then that's part of our purpose. But how can we help you as value makers? But also, secondly, utilising all of you to kind of understand what more the Regional Academy can do to support, you know, people who aren't value makers, so that kind of wider finance community in the Midlands. And that doesn't necessarily have to be just the things that we're doing under the NCI work stream. You know, it could be our other work streams, or something that we haven't actually touched on yet. So it's sort of taking the sort of people who sign up as a value maker and come along to these meetings are the sort of people I think could give us some of the best insight into, you know, what the Academy can be doing to, you know, to help, and what more we can put on. And something that I know Aoife has already been doing, which we just want to carry on supporting her with, is encouraging any organisations who are doing good things to share their work as part of the National ONF showcase sessions. So I think I just want to pop back to this. So hopefully now that I've explained the fact that we've brought this work stream into the Value Maker Network and what we're kind of looking for to do with it, with you as a group, just talk in a bit more detail through the action plan that we currently have. So this is sort of the final one that we had at the end of our 24-25 programme year, and we've just started 25-26. I did mention that we are looking to update the overall strategy for the Academy soon. That is on pause a little bit at the moment, because we're kind of waiting for a bit more indication from the kind of national ONF team on what their national sort of strategy development is going to look like, so that we can make sure that the regional one aligns. So while we're sort of waiting to do that, we're keen to not take our foot off the gas in terms of our you know, action plans and the work we're doing on the ground. So it's very much about taking advice from you all on, are these the right things to be doing? Are there different things that we should be doing, especially mindful of all the changes that are going on at the moment and how that is affecting people, and, you know, what the Academy is doing, and what more could we do. So we split it up into 2 aims. So one was around supporting networking. So that was about very much focusing on the sort of system-wide networking for ICSs, but also kind of networking across the whole region, and with a focus on the Value Maker Network. And then the second aim was very much about the Finance Innovation Forum programme. So something that we have been talking about in this work stream with the working group initially was looking at sort of in-person conference for the Midlands that would be Midlands wide. However, we kind of put that on pause because we sort of felt that firstly there might be too much overlap with the existing East and West Midlands branch conferences, which we wanted to support so that they are well attended and very valuable in their own right, and we didn't want to put something on that would sort of compete with them or detract from them. And the other difficulty we were having with this action was around location. If you're going to get people to travel to a face-to-face conference, finding somewhere in the Midlands that works for people both sort of East and West side seemed very challenging. So be interested. I know Zach has his own thoughts on this, on taking people's opinion on this, but we had kind of put a pin in that for the minute. So we focused very much instead about funding that we were making available for ICSs. So this was £2,000 plus VAT for every ICS, all 11 ICSs in the Midlands, to use to put towards networking for their system. So that money could go towards a face-to-face networking event they were running for the ICS, or it could go towards a series of online sessions they were running across the system. In some examples, we've actually had an individual organisation and system saying, can I use it just for our organisation? And as long as all the other organisations in that system were happy and agreed with that, then the money has gone towards just the individual organisation for sort of a development day or something they were doing. So it's quite flexible about how that money can be used. And it's been nice to see that in our first programme year in 23-24, only 3 of the ICSs used that funding. But last year in 24-25, 8 out of the 11 ICSs used the funding. So this is definitely something that we are keen to carry on doing and develop further by maybe doing a bit more sharing of how people are using that money, or just how they are running networking things in their system, and getting some case studies and good practice across to the systems that maybe aren't really doing it yet. And then next we have an action around generally engaging with the value makers. This so far has been mainly around the kind of number of value makers in the region and the number of value makers in each organisation. So you can see there our aim, is for to get to 500 and to have at least 3 value makers in every organisation. So there's tracking there of how that is going, which is going well. But I personally feel like there's something that we need to add into the action plan here about, it's not just about the number of value makers we have in the region. It's qualitative, not just quantitative. So it'd be good to kind of develop with this group and the Leeds Forum about what else can we be aiming to do with the Value Maker Network. There's not just about the number of people in it. And then next down, we had an action around, initially the Academy was looking to develop its own sort of series of online sessions that we were going to call Spotlight Sessions, which was just going to be general sort of case studies and best practice content. But actually working with our workstream group, we felt that would be overlapping too much with there's a huge amount of, there's the showcase sessions that ONF does, there's also obviously all the wider HFMA content. So we decided instead to put those efforts into these value maker meetings. So as I mentioned before, what I've been doing is working with EFA to try and find content for the value maker meetings rather than just putting on a whole separate series of sessions. So that's something that's just ongoing. We do run a separate talent management series each year, which is open to all finance staff in the region. But other than that, we're focusing kind of bringing presentation content to the value maker meetings. This was quite a new one that was just discussed in the last couple of NCI working group meetings. There was a suggestion around developing a regional network for costing in the Midlands. This was just an initial discussion with the working group. It hasn't really gone any further yet, partly because obviously we've closed that working group down now, but also I from my perspective, from what the Academy could do here, I've just felt like I needed to have this discussed a bit more and understand what we could do that wouldn't be overlapping too much with everything else that is already out there to support people who work in costing roles, because I'm very aware that there is a lot that the HFMA does, albeit on a national level, but there's also the groups that already exist in the Midlands. I think there's quite a few of them, and I know that the software suppliers also run their own groups. So we don't want to put on another network that's just going to be asking the same people to join multiple groups, and want to make sure that if we do something in the costing area from the Midlands Finance Academy, that it's valuable sort of in its own right. So initial thought I had, which would be good to pick up with you all and the Leeds group at some point, is whether perhaps we could take that idea and turn it into more of a sort of an EVO costing group in the Midlands. So if you're not aware of it, EVO is the Engagement Value Outcomes Framework, which NHS Finance developed and is available, which helps organisations take a framework around using costing data, PLIX data, and combining it with value metrics to understand the services they're running and improve them in a very brief way. But some of the real pioneers and leaders of this have been Midlands based. So I thought there could be an opportunity there to sort of bring that learning together a bit and help other Midlands organisations use that framework. So that's a thought I had about how we could develop that one. And then moving down, so that would kind of probably move that down to that second one. So we'd pull that down to the Finance Innovation Forum section. And then again, the Finance Innovation Forum, I personally feel like this is so far for the work stream we've been running, this has been an area that we've been doing less with. I think that there could be a great opportunity for the Midlands Finance Academy to do much more. So far it's been about kind of, do we have a peer reviewer in every organisation, and our organisations submitting innovations to the Finance Innovation Forum. So we're kind of tracking that, and you can see the numbers there. There is a good number of innovations that the Midlands put forward, especially compared to other regions nationally. But something that we haven't looked at yet with the group, which we wanted to, was not just do you submit innovations, but do you use innovations, and how do you use them, and maybe getting some advice on that from organisations who use the innovation library to really bring value back into their finance teams, especially considering that they ONF have just released a AI tool to help people use and explore the innovation library more effectively. So there could be something around that, even if it's just kind of comms. And also, I'm very keen for this area to work more closely with the Finance Innovation Forum in terms of all the new work that they're doing recently, especially, well, Rich is going to talk about this later today, but around things like AI and process mapping. And they're putting on sessions, with Ollie Deacon, which are hugely popular, and obviously the national team are doing that. So it's, for me, it's understanding about at a regional level, then what can the Academy do to further support that for finance staff in the Midlands, especially because we might have some budget we could put towards it. So I think there's an area there that, in terms of kind of the digital transformation work, that we could do more on with this group, and you guys can help us shape it. So hopefully that's helpful, that I've just kind of talked through where we had got to with our action plan when we were doing it with the NCI working group. And then last slide for me is ask of you all today. So I know that we've got Sophie and Rich from ONF talking about some other areas. But what I wanted to hopefully get from you guys today, and hopefully Zach has joined and can give his own thoughts to this as well, is any feedback on the current action plan that I've just talked through, but also specifically thoughts on areas that you think should be prioritised, but also reflections on whether there is anything else that the Academy, either just under the NCI workstream or more broadly, should be doing, particularly in light of all the current pressures and upcoming changes in the NHS landscape. So this is a good opportunity at the start of our 25-26 programme to kind of take stock a bit, especially now that we're working with you for the first time as a group, and really help develop, what we can do in 25, 26. I will pause there. Aoife, have we got Zach? Do you know?
Yes, it looks like he's on the call.
Hiya, Becky. I'm on the call now.
Hiya.
Hiya.
All right, I'll hand over to you then, Zach.
That's great. Thanks, Becky. Morning, everyone. Thank you for joining today. I appreciate people have got some very busy diaries. So I think just having listened through the update Becky has just provided, so it does feel very much so. There's a lot of work that's already in train with this particular working group. So I'm sort of delighted to join the group as chair. And as Becky said, I'm also a member of the National Finance Academy board for the Midlands, which is really good because it's an opportunity for us to obviously feed back into the board and also to request any areas of support. So apologies, I'm a few minutes late. What I'll do is I'll just briefly introduce myself. I'll give a little bit overview in terms of my background as well, and what's brought me here today. And I think it's we can then run through the rest of the agenda if that's okay, Becky. And I've got a few slides and stroke questions towards the end. So if we can have around 10 to 15 minutes towards the end, it'd be an opportune time for me just to gather some information. I appreciate walking into this after a lot of the good work Jill has kindly done with you guys on the particular group. Just before I kick off, just some sort of general housekeeping. I appreciate it's quite a large meeting and we can be quite shy at times, but I would just request if people are happy, if you could put on your cameras, please. Otherwise, it's fairly difficult to see who's on the call, and otherwise I'm just speaking to a blank screen as well. So thank you for that. I'd really appreciate it. So I'm Zach Hussain. I'm one of the Associate Directors of Finance here at University Hospitals Birmingham. I've been now with the Trust for just over 3 years. It's been an incredible journey with the University Hospitals Birmingham. But in terms of my background, I initially started out on my journey working in, oddly enough, investment banking. And I think a lot of that was down to when you graduate, a lot of the peer pressure tends to take you down a particular work stream. Having realised and done a degree in business and politics, I noticed the investment banking wasn't really an area that sat well with my values. So it was an opportune time for me to find a role within the public sector, and I'm fortunate enough, very lucky, to have secured a graduate scheme down in London. So I'm originally born and bred from Birmingham, and I moved to London for about 10 years, where I started working in local government, doing my training, and then I moved subsequently to the NHS. I originally started off in mental health, and then I moved over to an acute provider setting. So I've got fairly varied experience already within the NHS, and then for personal reasons, I decided to come home and come back to Birmingham, which has been great. London can get really busy, but whilst I was in London, I'm quite a keen advocate for people development, and a couple of things I got quite heavily involved in within London was the HFMA agenda nationally, and also some of the working groups in London. So we were looking to develop good code of ethics. We did quite a lot of work around EDI, and I sat alongside some very senior colleagues who were quite heavily involved in those working groups. Unfortunately for me, I was able to gain a lot of their experience and sort of their know-how in terms of addressing some very challenging and difficult issues, which is quite hard to talk about at times. And I also contribute towards, I'm SIPFA qualified, so I contribute and sit on the SIPFA's work stream for developing the role of the future CEO and CFOs, and that's been quite an interesting experience in itself. The world's moving on, I think, particularly post-COVID, with the whole funding regime changing, and organisations being asked to live within their means. So first and foremost, that's why I really appreciate you guys taking out the time to be part of this. I'm really keen that we utilise the time we have together. I think we've got a real range of individuals within the room. I think there's a lot we can learn from each other. There's a lot we can definitely take away. And I think we've been given the license and empowerment from the National Finance Academy and also ONF to set about what we would like to steer in terms of our community, our finance community in particular across the Midlands. What's brought me to this particular group? So as Becky alluded, I'm quite a keen advocate to talk to people, and you'll soon learn to tell me to shut up because I do talk quite a bit. But I think what I've really learned in my career today is networking collaboration does go a long way. There's so much you can learn through your colleagues, individuals across other organisations that have varied experiences and varied journeys. And I think I learned a lot around diversity within that, and it's probably helped me become a little bit more of an inclusive leader. But like I said, there's an opportunity there for us to all bring something to this particular group, and I'm really looking forward to working with you all to see how we can shape some of the milestones that I'm quite keen that we can achieve as the finance community in the Midlands. So I think that's all I sort of wanted to say for now. I'm more than happy for people to sort of reach out to myself individually or reach out after this meeting if you want to know more. But in terms of what I'd be quite keen for us to do is for today's session, if we can work through the agenda. I know we've got some of our colleagues doing certain slots on the agenda. That'd be great. And like I said, I've got a few questions I want to wrap up at the end. Just to take away some feedback from today's session, essentially, and therefore will help us to set up the appropriate milestones throughout the rest of this financial year. I hope that's okay. If no one's got any questions, Becky, are you okay if I hand back to you just to run us through the agenda, please?
Yeah, happy to. So Aoife has sent out the agenda. So hopefully everyone has got it. Zach, I'd already sort of done the presentation I was going to do. So we are running quite early. Aoife, do you know Sophie on yet? Oh, we've got questions. Okay, great.
I can message Sophie.
Yeah, what do you want to message Sophie and say that we're running quite early? But I think Zach, if it's all right, I'll kind of go back to and I can get it back on screen, sort of some of the ask that I was looking for at the end of my presentation, and we can take some thoughts and feedback from people, and then we can move on to Sophie's session if she's able to join. So let me get that back on screen while Luca, you can start us off.
Yeah, my question was about are we because you asked feedback, are we ready to get feedback, or we do
yes,
at the
ready
end?
to give feedback.
All right, okay. So one of the questions is what do we focus on for the future? And one more reflection is it's not secret that a lot of people in the next probably 6 to 9 months will probably lose their jobs in NHS because of requirement to decrease the corporate costs significantly, NHS England, ICBs, but also providers. So my reflection is there are a lot of people that come from private sector, but there are others that work their life in NHS and probably they find themselves a little bit unsure of what to take, how or where to take their career. Their careers next. So I wonder whether there is a potential, some support or resources that could be focused on helping those people with some additional coaching section or even mentoring or even group session to understand what can be done to help them to continue their career in finance, if it's not within NHS, outside NHS.
Yeah, thanks, Luca. Zach?
Thanks, Becky. Thanks, Luca. Really good question, and one which is probably more pertinent to our time today than it is previously. Now, what I would say, I think through this particular group, coming up with certain milestones and initiatives such as developing the finance community and retaining our staff is something I'm quite keen we develop. I think the opportunity to put in, whether that's through online workshops or something more face-to-face through networking, there's an opportunity to have some money allocated through the Finance Academy to do that. Interestingly, one of the areas I was thinking about, which I've experienced myself personally, and I know a lot of my teams and colleagues feel the same challenges around having the right level of resilience when it's coming to making some very difficult decisions, particularly when it comes to patient care. Given we know the finances are fairly restricted, I think having our teams developing those softer skills, I think we focus a lot around the technical ability, is something that we'd be quite keen to celebrate. And also, if we can secure the right amount of funding, I'd be more than happy to support putting on those type of sessions. So I think brainstorming along those lines is definitely the right approach, Luca.
Thank you.
Yeah, agreed. And just to say as well, to follow up from that, you know, we do things like sort of coaching sessions and interview preparation sessions and mentoring through both the regional academy and the sort of national ONF work, but those are very much focused on people working in NHS finance who are staying in NHS finance. So I think what you're sort of saying, Luca, there is the difference would be sort of putting something on quite specifically for people who are possibly going to be having to move out into different roles and then supporting them as a specific group of people. So we'll definitely take that away and look into it. Thank you. Any comments or questions or thoughts from anyone else? So I'm going to have to take the screen off because I can't see the full group. Any other thoughts from anyone else? No. Okay, well, like I said, you know, myself and Zach will be working with Aoife on these meetings now, and with the Leeds group. You know, if anyone else wants to join that Leeds group, then contact either Aoife or myself. And if anyone does want to send any kind of thoughts or reflections through, I'll pop my email on the chat. And please feel free to get in contact at any time. Aoife, do we have Sophie yet? If not, we can probably go through what Zach wanted to do at the end of the presentation.
We do have Sophie.
We do have Sophie. Hi, Sophie.
Hi, everyone.
Okay, so on the agenda, we are going to move on to Sophie's section next. Sophie's going to be talking about the NHS staff survey. Over to you, Sophie.
Hi, everyone. For anyone who doesn't know me, I'm Sophie Rowe, and I'm one of the senior programme managers at the One NHS Finance Central team. So as we have been doing now for the last, I think, 4 years, we've been looking at the Finance Directorate scores for the staff survey and where they're publicly available. And then we've also given organisations a chance to send them in if we couldn't get them publicly. So for 2024, we had 212 organisations in the sample. That's the largest we've ever had. So we hope this will give a bit of a really good kind of view of how finance staff are feeling across the board. Having said that, I think if we'd done the survey was done in the last few months, then scores might be a bit different to what they were a few months ago. But looking at the scores, the weighted averages, year-on-year comparisons, we can see they've stayed fairly similar. We've gone up slightly in some themes, and we've gone down a little bit in other themes, but generally fairly steady. I'll just keep that up there just for a few more seconds so people can have a chance to have a look. I'm happy to share this slide deck with you afterwards as well, so you can have a deeper look. So when we also have looked at kind of the highest and lowest scores for each category, and you can just see that there really is quite a stark difference between the highest an organisation's gotten compared to the lowest organisation. And particularly we noticed that we are always learning. There's a 3.27 in there, so there's probably some work that we can do around that. If we look at the regions, the Midlands has done pretty well. It's done in 3 of the categories. It's got the highest score. That's we are safe and healthy, we work flexibly, and morale. So that's but generally the Northwest is the top scoring region, and London scores the worst in the most categories. But it's just interesting to see that. And then we look at organisation type. This is the same as last year. ICBs and ambulance tend to score the lowest. And yeah, specialist and other, which includes a couple of organisations like MIAA in the Northwest who score particularly well. There's not that many organisations in the other category, which might distort that slightly. However, we do have a benchmarking tool on the website. So it's downloadable. I can send you the link. But you can then compare yourself to other organisations in the region, and then compare yourself to different organisation types, and it's all interactive, so you can have a fiddle around with the scores and see have a little play and have a look at that. So we looked at finance scores versus organisational average, and it's good to see that finance does score better on every single theme than the organisational average. But it's also interesting to see that it's a similar pattern to the lowest scoring is also for organisation averages. We are always learning, like it is for finance directorates, so it's kind of mirrors. And we also looked at accreditation levels and staff survey scores. This is people's accreditation levels as of the 31st of March, because I know that some are going to FLC this week, but we did it based on 31st of March this year. And as you can see, there is a clear correlation between your accreditation level and your staff survey scores. Level 3 is scoring the best in every category. The only anomaly for the other levels is we work flexibly, which was the same last year. It was we work flexibly, it was a slight anomaly. But I mean, it's good news for the accreditation program. Sending saying the things we wanted to say. But I think that's quite a powerful slide for the accreditation program. And then we look at the top scoring organisations. Liverpool Heart and Chest, it's the 3rd year in a row now. They have scored the top, and they scored this year. They scored the top in every single theme. So we've reached out to them to ask if there's anything additional they can share with us about how they're maintaining good scores each year. It's good to see we've got Derbyshire Healthcare, Midlands organisation there in the top 3. We've reached out to every single organisation in the top 10 and asked them for either a call or to send through any reflections as why they think they've scored well, so we can pull together some learning to share with other organisations. Oh, and also North Stats for the Midlands is also there now, which is good to see. And then the most improved organisations, which is also a really good thing to see. We've got NHS Shropshire and Telford ICB at the top. So well done, Wendy. I can see Wendy's on the call. And I've sent an email out as well to everyone in this list to kind of share reflections. And I expect Wendy will be approaching you to do a bit of a showcase on that, if you'd be happy to do that, to share that with others. And also Hereford and Worcestershire ICB in the Midlands, aren't they, as well? So the top 2 are in the Midlands, which is good to see. So next steps, we have now published the benchmarking tool on the website. It's downloadable. We are looking to learn from the top scoring organisations and the most improved organisations, and we pulled together a document last year to share some learning around that, and also to run some showcase sessions. We're also we are always learning is a bit of a frustration for the staff survey working group. It did go up slightly this year, but it's always the worst scoring theme. When we've asked organisations to provide the separation between development and appraisals that go into that theme, it is universally appraisals that brings that one down. We created a guide for meaning of appraisals a couple of years ago, and it was one of the most downloaded things on our website last year, and it was the most downloaded thing on our website in the last month, which is interesting to see. However, we want to we want to kind of gain a bit of understanding as why people don't find their appraisals meaningful, and what could be done about that. So we've pulled together a survey, which I've pulled together this morning because we only had the staff survey meeting last week. It's gone out to the steering group this morning, and we'll get that out hopefully by the end of the week. And anything that you can do to help people kind of it'll take 5 minutes to fill it in, just to get some kind of constructive and honest feedback about how people find their appraisals anonymously. So we can hopefully pull together, expand our guide, and kind of share some of the good things, as well as work on some of the areas that are not received so well by staff. So that should be coming out at the end of the week. Just a reminder of what we've got on our website already. As mentioned, the Guide for Meaningful Appraisals. We've got the showcase sessions from last year, which there is one from, I think, Liverpool Heart and Chest on there, and I think the Christie, they scored particularly well on appraisals last year, so they did a session as well, so they can all be watched back, and we will be doing more this year. And the benchmarking talks I've already mentioned. And just to remind people that we do have, under some of the People Promise themes, we've created loads of resources, and also some of the good things that organisations are doing under each of these scores, and we've packaged them together into the themes, so they're all downloadable on the website as well if people wanted to take a further look at do a particular deep dive into one of the themes that is more relevant to their organisation or finance department. And that's kind of our kind of overview of it, but I'd be really interested to hear from you all any reflections on that, or if there's anything further you'd like to find out, or anything more we can take back to the staff survey working group, meeting again in about 6 weeks' time. Thanks, everyone.
Thanks, Sophie. Zach, are you happy for us to do questions for Sophie? And any thoughts from yourself?
Thanks. Hi, Sophie. Thanks for coming along today.
No problem.
Really interesting survey results, particularly for those organisations that have been accredited at level 3, isn't it? I think it'd be really helpful, and I know you're doing this anyway, is to understand what they're doing differently. I think one of the things we were talking about earlier was, given the change in the finance environment we now operate in, supporting our sort of operation clinical colleagues is quite challenging. So for those organisations, it'd be interesting to see how they go about doing that whilst maintaining good relationships within finance, and also how their workforce has been set up in order to do that, because I think we can take some learning from some of those initiatives and spread it wider across the Midlands. So I'm not sure if you've got any earlier thoughts on that, or is that something you can help support us with, please?
Absolutely happy to support you on that. And at the moment, I'm putting in calls over the next few weeks with as many of the CFOs, FSD leads from those top scoring organisations and I'm actually attending a couple of team meetings to get their reflections from the team on what they think the organisation does well, which is why they've scored so well. So we can definitely share back that. And also the whole working with kind of operational colleagues bit is something that we're definitely looking into as part of our kind of work programme going forward. So yeah, we're definitely happy to report back on that when we've done a bit more work around it.
That's great, Sophie. Thank you very much.
Any other questions for Sophie from anyone about the staff survey results? No, Sophie? No questions for you?
Well, I'm happy to share the slides if that's helpful, and I'll put the link to the kind of benchmarking tool in the group chat, so everyone can have a little look and can see where organisations compare to others, etc., which is good. Right. Well, thanks, everybody.
Thanks, Sophie. Zach, do you want me to introduce the next session?
Yes, please, Becky. Thank you.
So I think hopefully we've got him joined. We've got Rich Sawyer, who's going to talk to you about the Innovation Forum and some updates, particularly around the work they're doing on process mapping and AI.
Good morning, Becky. Good morning, everyone. How are we all? Gosh, there's a lot of you here, isn't there? Nice.
Yeah, there's
right.
a lot in the Midlands.
Right. Thank you very much for inviting me here. I think we've got like 10 minutes, so I'll rattle through at a rate of knots. Any questions, just shout out. I won't be able to see my screen, so good chance to get vocal with any questions, please. If not, I'll pick them up at the end. This presentation is not going to be about what we have been doing in the forum recently. It's going to be more about what we're looking to do in the next 6 to 12 months, because it's a very exciting time. Covering the bits just briefly what we've got at the moment. So we've got about 200 plus innovations in the innovation library. What a lot of innovations that is. How do you start navigating them and finding out what's in them rather than clicking through web pages? And we've got an answer for you today on that, which is great. Software Skills Network. This is all about individuals needing to learn different new software skills, ones that are existing or ones that are emerging, supported by AI as well. That network has about 1,000 people as part of it, and the format it takes is on the Virtual Finance Network, which is an NMS Teams channel. There's been various sort of education and training materials added by good colleagues like yourself to that. That's actually getting a artificial intelligence bump in the next 3 weeks. Give myself a deadline there. I'm going to talk to you about that in a sec. As well. We also have a number of Evo sites as well, this is obviously my favourite region because we have quite a number of live sites in the Midlands, which is fantastic. North Staffs is the first ever national Evo site, and those of you not subscribed to the newsletter, there's been some really fantastic wins coming out of that, and those CFOs that aren't part of the aren't joining the Leadership Summit in July yet do, because we'll have presentations from North Staffs combined and their Evo team, and also Nottingham University Hospitals talking about the Wave and how that integrates into Evo as well, producing the first value impact comparison scores, or VIC scores for short. Very exciting. So sign up for that if you haven't already. Right, I'm going to do some slides and rattle through them. So probably need to change the title on this, but essentially this is all about the future of NHS finance teams. Those of you that haven't got an AI chatbot or an AI, or are using AI at all at home or in your personal lives, tonight is a bit of homework. Go home, download ChatGPT on your phones, type into it the things you have in your cupboard, in your kitchen, and it will give you a lovely recipe made out of things that you never thought was possible to make food out of. It can help you plan your lovely holidays. It can help you do all sorts of wonderful things. It's like your own personal assistant without having to pay them. Isn't that wonderful? And start interacting with this, because Copilot is not AI. I mean, it is AI, but it's not the most intelligent at all, actually. Copilot's a little bit stupid, bless it, and it is gaining pace, but there are a lot of models, later models, that are far more intelligent than Copilot, and there's incredible things happening week in, week out. So I'm going to talk to you about a bit of that now in the 6 minutes I've got remaining. It's going to be fun. Okay, so first off, we asked AI, what's the role of NHS finance in the future? This was back in January. Look at all these lovely things. We also asked some humans who, from the sort of tech sector, there's a Microsoft finance director and various other bits and people. And these bits were sort of the idea of what the finance function looks like in the future. So some might say that we're quite far away from that at the moment. Some might say that we're on our way to getting there. So the forum's trying to position itself and to help gain pace and get everyone pointing in that direction as best as possible. So we've got 3 things to talk to you about today, some of which are already on the way to being released, some of which we are working on at the moment. So using AI to map finance processes at scale. So this is all about, I mean, probably the trigger word for this is RPA, but there's sort of stands for robotic process automation. However, you Can't begin robotic process automation until you have mapped your processes. This is the first step, and we're engaging in essentially a lunch and learn every single month over the next 12 months. There's 2 already happened. We're very oversubscribed, and we're putting some more dates in the calendar. So any staff that are interested in learning how to map their processes, it's an hour-long session. We run through and we introduce you to your lovely AI assistant who's going to help you map your processes and redesign them. And that moves us all towards a standardized way of doing similar tasks. So that's run by a variety of people. The Microsoft Finance Director, Ollie Deacon, who you may or may not have heard of, is like a Duracell bunny, lots of energy and very well informed. I'm doing the next one, so if you want to sign in for that, you can. We're looking for volunteers to continue to sort of teach this and embed mapping and understanding your own processes at a basic level. It's very easy to do, very teachable, and with the benefit of AI that we have now, we are going to be able to redesign those processes in a more standardized way. It's very exciting, and this means that your staff in your trusts and your organizations will, when certain RPA or new software comes along, you'll be able to then sort of start assessing them from well, right off the bat, basically, rather than having to go through this extensive process at the beginning. So sort of starting you further along the route rather than waiting for the software and beginning all of that good stuff. Forgot my slides. This is the process that essentially teams will be learning and doing. There's more on this coming in the next couple of months, so we'll talk about that. This is a sort of standardization roadmap. It looks quite boring, but ultimately we'll be collecting processes as they're sent to us during the sessions over the next 12 months. We'll start getting an idea of what those processes look like for those processes that we have in common, raising a PO, etc. You know, enter blank process here. And we'll also be using this sort of simplify, standardize, automate. That's my cat, sorry, you'll have to ignore him. He's really loud and quite needy. Gonna put him out actually. Come on. Win. Right, so why are we process mapping now? Before, it was extremely hard to look at standardizing the systems and processes of NHS finance. Now it's really achievable because of the AI models that we have available. I can talk more about that, but in the next 2-3 weeks, we'll be releasing a ONF AI that is trained to help you with your processes and mapping them and your teams. And that will be secure communication on a private API. Those of you know what that means. And it'll allow your staff to start redesigning them. So join those sessions. Not going to bother with that slide or that one because I'm fast running out of time. Driving value in NHS finance playbook. So over the last year, NHS Finance has been looking at various improvement principles. There was a trip to Seattle to look at the Virginia Mason. There's a lot of quality improvement work and essentially also value-based improvement work, namely EVO, BPB and various other bits and pieces. The overarching question is, what is finance's role in these things? How are we sustainably able to improve quality while considering the consumption on resources and the factors that exist there? It's very important to start doing this if we are not already. Essentially this is developing a playbook that will be able to help finance understand their role in doing all of these things and be able to communicate that with ongoing QI improvement and waste reduction efforts. There's a lot of work that needs to happen with that. I might build another AI just so people don't have to read another playbook and maybe just ask a chatbot what's in it and what exists. We'll see what that looks like over the summer. Measuring impact, I'm not going to go into this now, but if you do turn up to the Leadership Summit in July, you'll see this in full working order, which essentially looks to use 3 tools across the EVO process to be able to produce the value impact comparison score, which is sustainable clinical transformation measured for various factors. Very exciting, not enough time. Please give me a shout if you're interested in this. That's the first AI that we built about 6 weeks ago. That's just finishing testing. It's called the Librarian, and in a couple of weeks you'll be able to go to the Innovation Library and just have a chat with the librarian. The librarian's very courteous, very interested in helping you and sending you to the innovations that will help you. You can give it your problems, you can give it your solutions, you can even give it what it's done, and it will find the top 3, 4, 5 innovations that would be most relevant to your issue. This is a sort of beta, and there's a number of others that we are going to be releasing shortly, namely a software skills learning assistant that will appear in the virtual finance network in the next sort of month or so. That's very exciting because essentially a lot of staff have an appetite for learning new skills and new processes in new ways. However, they don't have the time protected to be able to do that, the confidence to fail, which is just so important for this type of learning, and the playtime to be able to do that. But don't worry, they don't have to anymore because they've got a nice assistant to help them and ask all the not stupid questions of how to do certain things in new ways. So that's really exciting at the moment. And that looks like the end. Sorry for such a very fast ramble through. If there are any questions, please let me know. And don't forget the one takeaway from today: download ChatGPT or similar available AI on your phone and start using it personally, because you'll start seeing the possibilities professionally as you go through, and you'll eat lots of lovely food as well. Thank you very much for listening.
Thanks, Rich. I don't want to interrupt your flow, but we are actually running quite early today, so you could have taken a bit more time, but also, it's good to see you working at pace. So yeah, I mean, there is time for questions for Rich. So Luca?
Right, I want to take the opportunity that we are able to ask a question for Richard, but probably for the group. And I would like to think about embracing this innovation in a structured way. And I know that nationally, NHS England was looking at commissioning Copilot for Microsoft, where I found out today is a bit stupid, for the entire country. And that would be the right things to do. And I recently found another app called, for example, I don't want to, try to sponsor this, but called Manus. Is a Chinese-built app, and if you think that ChatGPT is good, Manus is another level. So, just give you an example. I took a template from one organization for a 5 years financial plan for a system, and so providers and ICB, and I took the IPR, the FPR, the template that providers submit for planning, and I asked the tool to use that template to take the IPR, to substitute the organization that they play with take the new growth rate, take the latest information from government in terms of demographic, and in 25 minutes, it did exactly what I suppose I could have done in a week. So just to give an example of disruptive innovation, but the problem is I used my 1,000 credit of app for free in one session. Then it will cost me $39 per month to use that. It could improve significantly my job and many other jobs. But my question is, how can we as a group try to, or if it's not already happening, try to make sure that we can go in the right direction together, rather than a scattered approach, everyone by organization purchasing products and not having any negotiation power with supply, rather than and try to maybe coordinate effort, maybe at national level, to try to see, okay, what is that our organization needs? How can we maximize the use of this resource, and try to build some purchasing power and try to commission probably jointly in the same way that NHS England was doing with Copilot. Sorry, a bit long, but this doesn't make sense. I just want to say there is a lot going on. There are things better than others. How can this group can work together, a region, but also nationally, to make sure this all aligned, and the process is structured so it can actually deliver the best value for money.
Thanks, Luca. Rich, do you have any thoughts on that?
Hi, Luca. How you doing? Been a while. Good to see you. I thought it might be useful for context just to explain what the massive gulf of difference there is between capabilities of AI, just for everyone here who might not be aware of that. I say Copilot's stupid, that's not fair. I'm sure it's really lovely and very kind and very helpful. However, the Copilot is specifically an offline model that is trained on Microsoft services. So your OneDrive, your Outlook, your Teams, your Excel, your Word, all of that stuff. It's essentially Microsoft has got that model. They invested 10 billion with ChatGPT to be able to have the ability to use Copilot and develop it themselves. So Copilot is pointed at all your Microsoft products. However, there are other models being released week by week at the moment that are far more advanced, but they also don't need to understand how to work with the Microsoft architecture and environment. So Copilot is going to be slow, but the benefits will be extraordinary. If you can use it in Outlook to be able to tell you your top 3 emails or whatever, that is an amazing power that other models can't do. However, for logical reasoning, for problem solving, like Luca's, the thing that Luca asked the Chinese model to do. I hope you anonymize the hell out of that, Luca, because there are security issues with all of that, but we won't go into that. But essentially, there are models now. For instance, GPT is at model 4.0, 4.0 mini even, and these don't mean anything. But essentially, when GPT launched at 3.5, the model that we're using now is about 3.5 times more powerful than that model now. The latest model in GPT, for example, in July, will be trained on all human knowledge. So, and the pace of these things being released over and over is quite extraordinary. So if you're wanting to do your problem solving or your really complex tasks or like a deep research task, it will go out into the internet, it'll index hundreds of web pages for you in about 20 minutes and then provide an overwhelming essay level response. GPT is the way to do that, or Gemini or various other ones. But the point is Copilot's not built for that. Copilot's built to make Microsoft products really easy for you or easier for you to use. And that's a huge distinction. A lot of people are going into Copilot going, I tried the AI, I asked it a simple question, it was rubbish, AI is rubbish. This is not the case. There are so many different iterations that Copilot has its use case, but it is not going to be your ultimate model. The only thing I'd add, Luca, is completely agree, going off on all these different tangents. There are so many different routes, and a lot of them are cheaper. China took about 3 trillion off the US stock market in January with their implementation of what was called DeepSeek, which was essentially they managed to build for 5 million, a model that was about 10 times more powerful than Microsoft model that they spent 10 billion on. Right, so this thing is changing so much at the moment, it's quite extraordinary. What we at One NHS Finance are trying to do is, while Copilot and organizations should procure this system because it will grow in intelligence and that helps you with Microsoft and it will help you automate stuff, the latest model, we're going to build a chatbot for you to be able to all use that within a secure API so that staff can start getting to touch with logic at the advanced level that Luca's talking about, and that will be available at scale, very soon in the coming months. So people can use all of the variations. The issue, doesn't it? It becomes with data, and trust needs to be really careful about what that looks like and what people are sharing, because you can't stop people pasting stuff into a chatbot, and that becomes really can become quite a serious issue as we know. So there's caution there. I hope that's helpful. Sorry about the waffle, but I thought it'd be useful for people to understand the breadth of capability, and one model is not the same as another, sort of thing. Thanks.
Thank you.
Thanks, Rich. That was really helpful. And yeah, really helpful thoughts from you, Luca, about how we need to use this as a finance community. So unless there's any other questions for Rich. Wendy. Can't hear you, Wendy.
Sorry, there's always one, isn't there? But maybe not so much a question for Rich particularly, just thinking about in terms of the value making network and sharing best practice, etc. There's got to be a lot we can do just sort of at a very basic level, because like there's a lot of acronyms that are being used in that, a lot that I don't just appreciate. No detriment to Rich. Your presentation was brilliant, but like it went way over my head, I'm not going to lie. So I get bits of it, but I didn't get a lot of it. And it's trying to harness what you do know to work to your best advantage, even just on a small scale within your team. So I'm aware of ChatGPT. So my son introduced me to that. So I'm all over that one. I haven't tried the recipes yet, but I will be for tea later. But it's about how we can use even Copilot sort of on a basic level in our day to day. Because I'll be quite honest, I saw the little symbol in the top corner every time you go on anything, but I didn't know that's what it was for. Like I've found it and I've asked it things, but like you say, because I'm maybe not using it in the right way, I'm not getting much out of it, so therefore I'm not using it. So I think there's got to be something we can do on even a very basic level just to get people starting to be introduced to the powers of AI, to Copilot, so that when the bigger things come on board, for want of a better expression, that we're all at a basic knowledge level. I suppose it's like trying to use Excel for the first time, isn't it? You have to go in it and try it and do it, and then you build your skills as you go through. So I think there's got to be a lot we can do within this community to sort of help introduce it, at least on a lower level.
Yeah, thanks, Wendy. Rich, is there plans from you guys, the national team, in terms of kind of basics on AI training?
So this is an interesting one, because we've had this discussion internally with staff, because obviously we're trying to sort this internally as well. Genuinely, the best way to learn AI and all the terms and all the rest of it is chuck a AI in front of you and have a chat with it. So, you know, all those questions you go, I don't know what he meant by that. I don't know what that person meant by that. What does this mean? Part of using it for the first time ever, I think, is just, okay, well, I'm just going to ask. And, you know, you just continually have this open conversation with something that will always know the answer and give you, within a degree of 85–90% accuracy, what the actual thing means or what that looks like. And so what we decided internally, at least, and organizations will make their own decisions, is if we can turn out a chatbot to staff, then essentially the first invitation is, don't know what I am, don't know what I do, don't know, you know, people are talking about things I don't understand, begin having a conversation with this avatar and or, you know, this assistant, and they will help you understand and do it. And that way you can essentially, learning can come at all levels, no matter whether you know, not even sure what AI stands for, or whether you understand what models are. All of those things are explainable. You can get them, you know, not that you would need to if you've got your 6-year-old there, you can get the chatbot to explain all of this stuff as if it was a nursery rhyme. So like the access and ability to understand stuff, rather than produce just reams of information and documents and stuff. Everyone knows what level they're at and what they understand and what they don't understand. The leveling down of conversation and interrogation to understand any concept is second to none and not been seen before at that to that degree. So really what we would say is that once that assistant's out there, and you can do this with Copilot as well, we're trying to encourage people to, like Excel, start using it to understand it, and you will understand it, because that's what the whole conversation is built for, in a way. I've now understood things in the last 2 months I never thought I'd get my head around, and I wouldn't have been able to had I not. So you're right, Wendy, it's about sort of getting people to realise that that is all they have to do, and protect the time as ever to be able to start doing that, which is why we're sort of trying to encourage people to do it in their personal time, because problem solving in personal life, I don't bother solving problems anymore. Just ask GPT and then all my problems are solved, right? Yeah, hope it's helpful. It's a weird one, because it's just such a brand new concept for learning.
Thanks, Rich. Just to follow up on that, definitely agree on the sort of approach of just start using it yourselves as individuals. The West and East Midlands SDM programs are starting to try and put on some more sessions, more specifically on Copilot, but also on sort of wider AI as well, which I think would be the sort of sessions that you were alluding to, Wendy. And perhaps it could be something that we bring back to one of these value maker meetings, is something around that. But in the meantime, yeah, absolutely take Rich's advice and just go and use them and try them. Going to move on now. Thank you, Rich. Back to Zach, who's going to just be doing a bit of getting some information from you guys, and then wrapping up. Thanks, Zach.
Thanks, Becky. I think you're doing a brilliant job as chair for me today. That was really helpful from Richard. I've had a go at AI, and I'm astonished at some of the information it can produce really quickly. I think there's something in there from listening to the conversations today. I think there's a series of actions we could probably take away. I think we need to give some thought around probably setting up as one of our objectives around some of the initiatives we can set up to develop our finance community. So there's a little bit of talk on that at the beginning, particularly around some of the workshops we can utilise already, and anything further we need to pick up on the back of the staff survey, which I thought had some really interesting results. And I think those areas where we're not featuring that well as a region is probably where we can think about putting in some targeted interventions. And I think on the AI, I think, yes, to Wendy's point, some of this is just around awareness. And I think, the questions I had in my mind was, is it something we could use confidently in an organisation, particularly where we've got information governance involved? What you don't want is people talking patient information into these apps, and I don't know where that information goes or how it's stored and recorded. So I think what we'll do probably after this meeting is to reach out to Richard and get a session on AI for us, and then we can take stock of that. And then if that's something we want to set up for the region, I think that'll be quite good, particularly as it's got quite a few efficiencies around it. So as I said earlier, I've got just a few slides where I've got some questions, and it'd be great just to take some anonymous feedback. As I said, I've sort of come into this group, and I'd just like to take the opportunity to take stock of where we are and what is it that we can try and achieve as a group together. And therefore, following this meeting, I think I'll work with the likes of Becky to set up some relevant sort of milestones and objectives, and I guess we can look to discuss that at our next meeting. So I'm going to just quickly share my screen. It's on Mentimeter, if anyone's used that before. If I could find it. Let's try this one. Okay. So to join this, there's a code. Just bear with me. Nope, it's not that one. Just going to reshare it so the code can come on the screen. Okay. I've just dropped a link in the chat. Hopefully that will make it a little bit easier to access it. Just if you could just shout out if you can't get into it, that'd be great. Thanks. Okay, I think we've got most people in. I'll just give it another minute and then we'll go through some of the slides. Okay, so on your devices, you should see the first question come up. And I think the question, why are you here, is just a little bit about understanding what is it that everyone's looking to sort of achieve, because I appreciate everyone's giving up quite a bit of their own time. So we want to make sure it's used as effectively as possible. It should be free text, so if you want to put in your comments, it'll appear on screen. Okay, some really good comments coming through around AI best practice. Learning about initiatives and best practice in the region, connecting with other value makers, keep up to date. That's a good point. There's always quite a lot happening, isn't there, regionally, nationally. Okay, there's quite a few themes I'm picking up. So the first one's around having an update around what is happening locally and nationally. So again, that's probably more around raising awareness. Something around connecting with colleagues is coming through, which is great to see. And also how we can support any new developments and best practices. Okay, brilliant. That's really helpful. I'll just give it another minute and move on to the next one. Yeah, I think the comment around looking to see what we can all learn and share from one another is a really good point. Okay, let's move on then. So what do you feel we can achieve together as a group? So it feels like we've got a series of themes coming through. It'd be good to really get people's ideas on what you feel is realistic for us to achieve, so we can build a set of objectives around this. Okay, it's quite a bit around sharing of best practice and consistency across organisations. Okay, brilliant. There's quite a bit on here that's coming out around how we can share good learnings from one another and roll that out across the finance community. So definitely one we can think about as a group. Okay, brilliant. So if I move on to the next one then. So if you had to pick one goal for us, what would it be? Yeah, really good point around having a community feel of finance colleagues, particularly as we know the environment's coming to become more challenging. Quite a few comments around how we utilize AI better. I'll give it another minute or so. I think this is fairly important for us so that we can help you use some of this information to define some of the milestones we may want to work towards. Okay, that's been really helpful. Thank you everyone for your feedback on that. I think it's given us quite a bit food for thought. So we'll take this feedback offline, and I'll work with the guys to come back to one of the future meetings on what potential objectives we could look at as a group moving forward. Okay, some random questions which I'd like to do just to wrap up. So, would you rather have all the qualities of a lion or an elephant? Be interesting to see how many lions we've got in the room. Looks like the elephants are winning. Okay, it looks like the elephants have won that one. So, would you rather work a job where you interact with people all day, or work a job where you are at a desk all day? Got a really good balance of individuals in the room, which is great to see. Okay, great. We've got a tie on that one. And then last question. Would you rather be the only person in an office of monkeys or the online monkey in an office of people? Brilliant. Okay. I think we've got more people who would like to be the online monkey and an office people. I might be a bit more swayed towards that myself personally. Right, brilliant. I'm going to stop there. I think that's all the slides I wanted to go through. So thank you for taking the time to provide that feedback. We're running a few minutes over, so I'll just quickly wrap up if that's okay, Becky. Our next meeting is taking place on Wednesday, 23rd. Is that in July, Becky? Sorry.
Yeah, July.
Brilliant. And it's due to take place between 12 and 1:30. What we'll look to do between now and that session is we'll circulate some of the feedback we've collated, some of the key themes coming out, and I'll be quite keen for us as a group to come up with what we feel are some of the key milestones we want to try and achieve over the next 12 months and what level of support we may need to do that. So just to end on saying thank you very much for your time today. I appreciate everyone's got really busy diaries, but hopefully you've taken some sort of shared learning away from today's session, and I look forward to seeing you at the next session. Otherwise, have a great week. Thank you, guys. Take care. Bye for now.
Thanks, everyone. Bye.